I'm Dr. Andrew Brandeis. Welcome to part 4 of the Intestinal Repair Protocol, the diagnostic approach. So, testing for pathogenic infections in the intestines is certainly interesting. There's two main kinds of tests that we do to determine if there's something living in the intestines that shouldn't be there. So the first test is a stool culture, and that's where you will send a stool sample to a lab, and they'll grow out the bacteria or yeast that might be living in the stool, and they can tell you what's going on there. And a stool culture is generally good if you have an acute infection and we need to know what the best antibiotic will be to treat that infection. But a stool culture isn't necessarily the best way to determine a subclinical infection. And as I mentioned earlier, a subclinical infection is one where either the symptoms aren't really presenting very clearly, or they're not very dominant symptoms, or the infection isn't great enough to show up on a lab test. The second type of stool test that we do is what's called an O&P times 3, ovum and parasite times 3. So an ovum and parasite times 3 is looking for eggs or parasites that might be living in the intestines that would be excreted in the stool. And the reason there's a times 3 here is because we usually do this test 3 times because it has such a high false negative rate, meaning there's such a high likelihood of missing an infection. We want to get 3 samples so that if there's something there, we can make sure to get it. Any sort of stool testing, either a culture or an O&P times 3, has a high degree of false negatives. So I've seen countless results from labs where a patient had a stool test and it revealed no infection, when I knew that there was an infection. They had all the symptoms of an infection. I think it's really sad when a doctor takes lab results and say, well, this is what the lab says. I don't care what you're saying. I only care what the lab says. And, labs are only as good as the people working in the lab. So, Quest and LabCorp, these are two of the most popular labs in the United States. And they're sort of generalist labs, right? They do everything. That's where you send your blood samples. It's where you send, every kind of sample. You can send it to Quest and LabCorp. And what happens at these labs is that you just have any old lab technician doing the test. And in the case of, say, an O&P times 3, the way this test is done is the lab technician will smear some stool on a slide, dye it with a particular kind of stain, and then look in a microscope to see what they see. And if you're not highly skilled, and this isn't something that you specialize in, there's a high likelihood that you're going to miss an infection unless it's overwhelming. And as I had mentioned, a lot of patients on the intestinal repair program have subclinical infections and possibly multiple subclinical infections. So it's really difficult to expect a general lab to do a very good stool test, which is why I love this lab for doing stool samples. Parasitology Center, or parasitetesting.com, is run by a Dr. Amen, and he is a parasitologist. And he's a parasitologist that looks at every sample himself, or has a highly trained staff, and all they do all day, every day, is look at stool samples. These guys know what they're doing, and they do it great. I've had tremendous results working with them. So if you get to the point in the intestinal repair protocol where we need to test your stool to see what's going on, you'll go to parasitetesting.com and you'll create an account. And it's very clear, it's very simple. You'll prepay them. They'll send you a test kit, and then the test kit has all the instructions and shipping necessary to send this kit back to them. It's important that you put my name and phone number, which will be presented at the bottom of the screen, so that they can send the results to me and I can have them for our online visit. So after you have your testing done, we'll schedule a visit with me or one of my colleagues to have an online visit where we can go over not only the results of your lab tests, but also the results of the previous months on the intestinal repair protocol, and we can further tweak and refine your treatment as necessary. Oftentimes at this point is when I'll prescribe pharmaceutical antimicrobials to my patients to treat lingering either parasitic infections or fungal infections or even bacterial infections that have yet to resolve on their own. And the reason I wait till this point in the protocol to do these treatments as opposed to in the beginning is that if you haven't done 3 months of rebuilding and repairing the intestines, then no amount of pharmaceutical treatment of just killing invaders is going to help, because there's no robust infrastructure for your immune system to take hold underneath. So once we've rebuilt the lining and established a healthy ecosystem, it's very easy to permanently eradicate an infection that may be present. So at this point, we'll meet online and we'll tweak the protocol as necessary for you, so that we make sure that when your time with the intestinal repair protocol is over, you are symptom free. And that was part 4, the diagnostic approach of the intestinal repair protocol.